20 to 29. So I spoke with Dr. Luiza Petre, a cardiologist working in New York City, for some insight on it. Dr. Petre, a new study finds that young people now are the largest group of COVID carriers in the United States.
Indeed, Chance, we have seen a change in demographics with more and more young people being accountable for more COVID cases. Now we are seeing 1 in 5 patients being at the age between 20 and 29, and there are a few explanations why that it's happening. Number one, they have milder disease or can be more asymptomatic, therefore they are not aware they are spreading the disease. Secondly, it coincides with the fall and opening of the schools. We have seen already 80,000 cases related to schools reopening. Third, young people are more invincible. Therefore, they are more cavalier about the measurements for social distancing and wearing masks.
Well, you talked about this, that maybe young people feel invincible, but I wonder what the contributing factor is. Is it that young people just inherently take more risks in their behavior, or is it that they have to be out there working? They're not retired.
There are two factors here. One, they are more quarantine fatigue. And secondly, it comes to the age you feel like in 20s, disease is not going to affect you. And of course, they see that younger people have milder symptoms as well.
Scientists are also finding that there are a lot of strains of COVID, and it looks like a more contagious strain is taking over in some areas.
Chance, this is not surprising because all viruses mutate. So to see new strains who are more contagious or who have more severe symptoms, it's expected. So what we are seeing in Texas right now, it's a strain that apparently spreads much faster, and we should expect variances like that.
It's expected. Is it worrisome?
Yes. It can be worrisome because that means one person can infect more people. And that means the pandemic can grow at a faster rate if indeed that strain spreads out to other areas.
One more thing I wanted to ask you about, Dr. Petre. In New York, they announced today that even after the FDA, the federal government, decides, okay, this vaccine is safe, go to market, that they want to do their own verification. Governor Cuomo, he was quoted in the Times this: "I'm not going to trust the federal government opinion." Is that a good idea or a bad idea, doctor, that each individual state is doing their own post-verification?
Here, Chance, I'm siding with science, so I'm staying away of politics. But in today's landscape of politicization of this virus, it's not surprising that Governor Cuomo decided to take extra precautions to make sure this vaccine is safe and effective. It is unlikely that other states will follow. I think it's a matter of time before we gain confidence and most states will follow without the extra steps.
Are they even able to do that? I mean, how would a state do that? They would just go over the data? They can't run all the trials again, you know?
Definitely, they cannot rerun the trials, but most likely they require and look into how the data was processed. They'll look at the studies to make sure that enough people were selected, minorities are included enough. So I think that they're most likely going to look at the data.
Dr. Petre, thank you so much.
Thank you.
Earlier this week, we brought you a story about how some